WHO has stated that there has in fact been 10,000 deaths that has been reported due to COVID in the month of December 2023. Now remember, these data that has been stated by WHO is in fact been sent to them by around 50 countries that majorly are from Europe and US. Now that is something that has also been highlighted by WHO, is that majority of the data are only coming in from around 50 countries, where the rest of the countries in fact has been not been reporting it. Either they have reduced reporting the data to WHO or have completely stopped it. Now that is a concern that has been raised by WHO, saying that until and unless these data are not shared by WHO, they will not be able to understand the implication of JN.1. Now, based on these data that has been collected by WHO, they have in fact noticed how 42% of increase has been seen in hospitalization. Apart from that, around 62% increase has been seen in ICU bed admissions. All this was possible because of the data that is being shared by these countries to WHO, and that is why the WHO has in fact been asking all the countries to make sure that they are reporting the data and are sharing these data with WHO. Now, apart from these, the other concerns that has been raised by WHO is regarding how there is in fact an increase in the respiratory illnesses. That includes pneumonia, that includes rhinovirus, and regarding this, they have suggested all the countries to make sure that people are wearing masks. Apart from that, they are taking vaccination, the appropriate vaccination for these diseases, whichever is present in their particular countries. Now, though we have seen how WHO has been saying that the pandemic is almost over, but at the same time, the WHO chief yesterday said maybe the pandemic is over, but at the same time, the viruses are changing, they are evolving, and we need to be alert and we cannot put our guards down. And that is why they are constantly in touch with number of countries, asking the government to make sure that they are keeping a constant vigil on these cases and are in fact following the guidelines that has in fact been put by WHO. Apart from these, vaccination is something that has also been emphasized by WHO, saying that JN.1, when we talk about this variant, it is highly transmissible, but at the same time, the present vaccines are working against this virus, and hence the vaccination, whoever have not taken it, the respective countries should make sure that their people are well protected and they are vaccinated as far as JN.1 cases are concerned. Now, when we talk about India, we are seeing that around 923 cases of this particular variant, JN.1, has in fact been reported, and there are about 15 to 16 states and UTs where the JN.1 is being reported. Majority of the cases are coming from Karnataka, followed by Maharashtra, Kerala, Andhra Pradesh, Goa, Gujarat, and hence we are seeing that the government is keeping a constant vigil. They are in touch with all the state and UTs, asking them to ensure that they are monitoring the situation and are sending as many as positive samples for genome sequencing so that they can understand what is really the implication of JN.1 variant on ground.
For more news and updates, all you need to do is follow CNBC TV 18 on all of our digital platforms.